Stomach pain at night, causes and prevention. Nighttime abdominal pain, sometimes called stomach pain, can occur for various reasons. Often it is due to gas or other digestive issues, but there may be more severe underlying issues such as gallstones. Here in this video, learn about some common causes of nighttime abdominal pain and how to prevent it. Common causes. Digestive problems are considered the most common cause of abdominal pain at night. Eating close to bedtime means digestion is more likely to occur while lying down, making it easier for stomach acid to travel back up the digestive tract. Sleeping difficulties and sleep disorders can make conditions like ulcer disease, irritable bowel syndrome, and inflammatory bowel disease more likely or worse. Lying down can also increase pressure on some muscular, joint, or bone injuries, making pain and discomfort more intense. Here are some common causes of nighttime abdominal pain. Gas. Gas in the digestive tract is a common cause of abdominal pain. It can lead to digestion, bloating, and discomfort. It leaves the body through belching or passing gas. Gas usually enters the body when people swallow gas, for example, when smoking, chewing gum, eating quickly, or consuming fizzy drinks. Certain bacteria in the gut also produce gas when they break down carbohydrates. Sometimes it results from a medical condition such as irritable bowel disease or food sensitivity. Acid reflux. Acid reflux is when stomach acids travel up into the food pipe. It can cause a burning sensation, nausea, vomiting, gas, bloating, sore throat, and a cough. Various factors may increase the risk of acid reflux, such as high alcohol consumption, overeating, especially close to bedtime, lying down too soon after eating, being overweight, high fat, spicy, and fried foods, along with chocolate and coffee. Gastroesophageal reflux disease. Gastroesophageal reflux disease is a common cause. Conditions that inflame the food pipe cause heartburn, nausea, and indigestion. Symptoms often intensify when lying down. Gastritis. Gastritis is where the stomach walls become irritated and inflamed. This can lead to a sense of pain or burning, as well as nausea, vomiting, and gas. Untreated cases can lead to ulcers, bleeding, and cancer. Stomach and intestinal or peptic ulcers. Stomach ulcers and intestinal ulcers can cause a burning sensation in the stomach region. Pain can worsen after eating as well as when the stomach is empty. Nighttime is often the longest stretch of the day between meals. Causes include H. pylori bacteria, overuse or prolonged use of non-steroidal anti-inflammatory drugs, tumors in rare cases. Gallstones. The gallbladder is a small organ beneath the liver that releases bile. Secretions can build up and form hardened lumps called gallstones. Gallstones can range in size from a speck of sand to a golf ball. Pain occurs when gallstones cause a blockage in the duct system of the gallbladder, liver, or pancreas. Fatty or rich meals can worsen gallstone symptoms since bile helps the body digest fat. Some individuals with gallstones have no symptoms and do not need medical help. People with recurring gallbladder pain or inflammation may need surgery to remove the gallbladder. As well as pain, gallstones can also cause the following complications: nausea or vomiting, fever, yellowing of the skin and eyes, unexplained exhaustion, light-colored stool. Irritable bowel syndrome. Some people with irritable bowel syndrome experience nighttime abdominal pain. Symptoms include abdominal pain and changes in bowel movements. Having a large evening meal may worsen nighttime abdominal pain in individuals with irritable bowel syndrome. Around 5 to 10% of people have irritable bowel syndrome, and most are under 50. Celiac disease, an allergy or gluten, a protein in wheat, barley, rye and spelt, causes inflammation of the small intestine, often with cramping and abdominal pain. Genetic factors probably underlie the allergy. Symptoms typically relate to the digestive system and include diarrhea, tiredness and bloating. However, some people have no symptoms. Without diagnosis or treatment, complications can arise. They include dental problems, delayed puberty, mood changes, and reduced growth due to vitamin and mineral deficiencies. Around 1 in 100 people globally have celiac disease, but around 30% do not have a diagnosis. Crohn's disease. Crohn's disease is a type of irritable bowel disease. It is an inflammation of the digestive tract lining that causes diarrhea, abdominal pain, weight loss, anemia, and fatigue, among other symptoms. Experts do not know why it develops, but it may be due to an autoimmune reaction or genetic factors. Smoking may also increase the risk. Menstrual cramps. Cramping, bloating, gas and discomfort are common during menstruation as the uterine lining sheds. Symptoms range from mild to severe and may affect the back and legs. There may also be nausea, vomiting, headaches and other symptoms. Endometriosis. With endometriosis, tissue similar to endometrial tissue grows outside the uterus. This can cause severe or persistent pain, bleeding and spotting, and digestive problems. It can make it harder to become pregnant. Endometriosis may affect over 11% of females aged 15 to 44 in the United States. Food intolerances. Individuals with a food intolerance have a sensitivity to certain foods and cannot properly digest or process them. They may experience pain, bloating, diarrhea and gas. Symptoms usually start soon after eating the food but may appear up to 48 hours later. Lactose intolerance is a common food intolerance that causes severe abdominal cramping and pain. Constipation. Constipation makes it difficult to pass stool. As a result, waste products build up in the colon, leading to distension, pain and pressure throughout the abdomen. Stools will be hard, dry and difficult to pass. Constipation can happen for many reasons, including dietary factors, certain medications or an underlying health condition. When to see a doctor. Often, nighttime abdominal pain is not a reason for immediate concern. Severe or persistent symptoms, however, need medical attention. People also should seek medical advice if they have additional symptoms such as severe or ongoing pain that does not lessen with over-the-counter medications, fever, difficulty breathing, unexplained weight loss, abdominal swelling or inflammation, abdomen that is painful to touch, yellowing of the skin and eyes, ongoing nausea or vomiting, especially if vomiting blood in the stool, pain that occurs during pregnancy, joint and muscle aches. Sometimes sudden severe pain can indicate a more serious condition such as appendicitis. Appendicitis can cause pain that begins around the belly button and travels downward into the lower right side. It then usually worsens with the slightest activity or movement. Prevention. Tips for preventing and managing nighttime abdominal pain will depend on the cause. They include avoiding eating close to the bedtime, raising the head of the bed while sleeping, avoiding rich or fatty foods, coffee or chocolate at night, avoiding or limiting alcohol consumption, avoiding overeating, using over-the-counter medications, asking a doctor about symptoms that could indicate an underlying conditions.